Welcome to Survey and Beyond, the data collection podcast by Survey CTO. We share expert insights and practical tips on data collection and analysis, discuss innovative methods and tools to enhance data quality and security, and demystify complex data concepts to help people collecting data all around the world. I'm your host, Marta Costa. Joining us today is Amelia Burke-Garcia, Director of the Center for Health Communication Science at NORC at University of Chicago and an award-winning expert in health communication. Amelia has led groundbreaking campaigns tackling critical issues like vaccine hesitancy and health equity. And she's a thought leader in integrating innovative tools like AI into health messaging. With her work spanning from spearheading the CDC's How Right Now campaign to developing NORC's cutting-edge health communication AI initiative, Amelia's career embodies the transformative potential of data-driven and community-centered communication. She is also an accomplished author, having written Communicating Through a Pandemic, a Chronicle of Experiences, Lessons Learned, and a Vision for the Future, a deeply insightful guide to effective communication in times of crisis. Today, we will delve into the intersections of data, AI, and inclusivity in reshaping health communication for the future. Welcome, Amelia.
Thank you, Marta. That's such a lovely intro. Thank you. It's an honor and pleasure to be here and talk with you.
Thank you so much. It's an honor for me, absolutely. So to kick off the conversation, Amelia, you have incredible experience related to data-driven health communication. Do you want to share what drew you to this field?
Yeah. So I think I always was really interested in health and health topics and how people make decisions about their health. And when I was actually quite young, I read a book called The Jungle by Upton Sinclair. And that was a book that was published in the early 1900s. And essentially, it was an expose on business practices. And in particular, in that book, it was the meatpacking industry and how unsafe things were. And that book, in fact, really led to a lot of changes as it relates to food safety. And I remember reading that book, and despite all of the gore of that book, it really sort of prompted me to think about the processes by which we get and have access to a lot of the things that we sort of have day to day that we might take for granted. And for me, that really piqued my interest in public health and public health's role in sort of being behind the curtain in terms of safety and prevention and really trying to protect the public's health. And so that's, I think, one of those early moments for me that inspired me and where I got a lot of interest in this space. And as I started to kind of work in this space and I found communication and sort of the communication of health, that really interested me because I didn't grow up knowing about a field of health communication. I didn't know that was something. And as I learned more about it, it is a field that is established and has theories and frameworks and models and a lot of evidence and a lot of ways of thinking about evaluating communication interventions as it relates to health. And this idea that there was a science to communicating about health, that intrigued me. And then specifically as a health communication practitioner who's focused on digital technologies, the advent of digital and the advent of social really opened up this monumental opportunity to have access to data that we'd never had access to before in terms of how people are engaging with things and how things are being shared and what people think about things. And so that really kind of kept spurring me to grow and learn and invest in this space. And that all sort of brought me to where I am today.
Wow. Thank you for sharing. What do you think in your work leading health communication campaigns is the most underestimated challenge, particularly ensuring that data remains both actionable and accurate across different health contexts?
Yeah, it's a really, really good question, right? And I'll speak from the health communication context, but I think that some of these issues are universal when it comes to research and data collection, right? So I think the first issue is inclusion, right? Who are you including in your data set? And I think historically, we've not done a great job all the time of ensuring that all the right voices are included in the data. And what that means is that you just don't get an accurate picture of what's going on. So you're making decisions based on data that only represent the experiences of certain groups of people. And those are not necessarily universal experiences. And those are not also experiences that reflect, nuances of different types of communities and different experiences with different health issues. And so I think you end up not necessarily making the most informed decisions around what kinds of policy or communication interventions are needed, because you just don't have a full picture. I think the next issue or challenge is interpretation of those data, right? So if you do, let's say you do have a great data set that has a wide range and mix of perspectives, and it's inclusive of different groups of people and communities of people. If the research team, if the study team is not interpreting those data in the right way, that also doesn't mean you end up with good, actionable data with which to make different decisions around outcomes or what is needed. And so this all kind of gets to this idea of building with communities, right? Like designing research and doing data collection with communities, which gets to I think, what is the third challenge, which is feedback loops, right? Historically, this is not something that's been done in research, right? We have always believed that research needs to remain objective, and that gives us a better picture of what's going on. But I think the downside to that, I mean, there certainly are benefits to conducting research in that way. But the downside to that is that you end up being removed from what you're doing, which I think has led to some level of miss and distrust, and can lead to some of those things that we just talked about, right? So misinterpretation of data, or groups being left out of the data collection effort, which means that their perspectives are not factored into what is needed. And when you co-design and co-create and co-build with communities, you're not saying, we're going to collect your data, thank you very much, and then we're going to come up with what you all need, and then here you go, community, you're welcome. Instead, what you're doing is actually centering those people and those lived experiences in those communities at the center of the research, and they get to have a say in what is needed in their communities. And I think that one results in better data, better interpretation of data, and the development of interventions that are both evidence-based but also community-driven, so that they can actually take hold, be trusted, be believed in, and be effective, right? And ultimately, hopefully, we hope that people live healthier lives because of them. So I think that there are those challenges, but it's the way we approach doing research that I think is critically important to be able to overcome them.
Okay, so I really want to dig into those challenges so that we can maybe understand better what other people working in the same field as you, what are the most effective strategies and solutions. You have been working in many different campaigns that are important for underserved populations. One example was the How Right Now campaign that I mentioned in the introduction. Correct me if I'm wrong. This is a campaign provided by CDC, the Centers for Disease Control and Prevention, and designed to promote the emotional well-being of people disproportionately impacted by mental health challenges. This is just one example. I'm sure you have worked with a lot other health campaigns similar, important to minorities and other underserved populations. What specific data collection tools or methods do you think are the most effective in these cases?
That's a great follow-on question to what we just kind of talked about, right? That we started talking about. How Right Now is a great example of multi-mode data collection and how powerful that can be to informing the development of a evidence-based, inclusive, and successful, because through our evaluation, we found that it was successful communications campaign in this case. It's worth noting that How Right Now is a campaign of both CDC and the CDC Foundation. So I just wanted to add that in. But I think what makes it so special is that historically, How Right Now has not been a campaign that is a traditional sort of mass media campaign that you think of when you think of like the word campaign. It really has been a through and with partners and trusted voices campaign. So what that means is that we engaged a wide variety of local, community-based, and national organizational partners to be part of the campaign from its inception. We actually didn't start out thinking, oh, we're going to develop a campaign. We knew we had to do some kind of communication support mechanism. It started in the early days of the pandemic. We knew that people would be struggling as we went into stay-at-home measures. And so they would need access to different types of resources and messaging that could be supportive in terms of their mental health challenges, their desire to cope and be resilient through those early days. But we weren't going to go out and run a whole bunch of ads. That was not sort of like what we set out to do. And so what we started with was formative research. And our partners were a big piece of that formative research process. So they participated both in in-depth interview conversations, sort of one-on-one with them. They also helped recruit and engage members of their communities to participate in, and they helped convene them as well, listening sessions. So we could listen to what communities were experiencing, especially in those early days, and what they needed. And what we heard was essentially what would go into building a campaign, and that became How Right Now. So we went in with a very open mind. We wanted to build for people what they said that they needed. And partners were critical to that early process. And in addition to that, we met with them on a regular basis throughout those early days of the campaign, because I think none of us thought we would be in stay-at-home measures for as long as we were. And therefore, we didn't think that How Right Now would be around for as long as it actually has been. I mean, it's still actually in existence. So, but we certainly thought, okay, we're going to stand up something very quickly. We're going to get some messaging and resources out to people. And then maybe by the fall, we'll all be back to normal and we can bring it down. Like, we won't need it anymore, right? And what turns out is, we went into the holiday season, the winter season, and How Right Now had a very important role to play in terms of helping people through not just those early days, but as we proceeded throughout the next year, giving people continued messaging and supports that could address sort of what they were feeling in those days, right? As it shifted. And the partners were the critical conduits to hearing from communities about what they were needing in real time, right? So we were able to pivot and we were able to develop new messages because our partners were saying, hey, this is going to be an issue. We are hearing this from our communities. So the idea of working together to both design what was needed and evolve it over time was one of the major success points for that campaign, because we could not have done that. Our messages would have been evergreen and maybe become irrelevant and tone deaf at some point because we were not listening to what was going on in people's lives. And then in addition to that, partners also were our main dissemination channel. Again, we ran a small bit of media throughout the campaign, but they really were our primary channels through which we disseminated our messages, and they were part of our evaluation. So they were able to give us back some data on what they did and what were some of the metrics related to those activities that we could factor into how we evaluated the success of the campaign, which incidentally showed that after exposure to How Right Now messaging, there were statistically significant positive increases in terms of people's confidence in their ability to cope and be resilient through those times. And we've seen that in subsequent evaluations, which is exciting. So even though it's sort of over the years, how right now has actually shifted to focus on different groups where mental health and coping and resilience challenges were emerging, that first evaluation onward, we've seen similar types of successes after exposure to those messages. And I do think that's a testament to how we approached building that campaign. It's worth noting that we also did other types of data collection. We did a national survey through NORC, the Mayor Speak platform, which is our in-house national probability panel. We did qualitative focus groups online. We looked at public social media conversations, and we factored all of that into the development of the campaign and how it rolled out, and then ultimately its evaluations. But partners were paramount to the campaign and to its success.
And having so many data collection tools, surveys, different types of data, how do you integrate all of that data, and what are the main challenges around that?
Yeah, I love this question. And this is exactly what we do at NORC. And this is how we approach health communication science at NORC. It's a great follow-on question because we just talked about how right now, and so just as an example, we had to stand that campaign up very quickly, right? So within 3 months, we began working with CDC and the CDC Foundation. We had to do rapid data collection as part of our formative research. We built the brand, we built the website, we built the messaging, and we launched. And so in order for us to be able to do that as quickly as we did, we couldn't rely just on one data source, right? We actually needed to look at multiple data sources because we didn't have the time to conduct sort of consecutive rounds of data collection, right? We didn't have time to do some qualitative to inform an instrument for a survey, to go out and talk to partners, right? And so we had to just do a whole lot all at once. And so we did prioritize all of these different channels and modes of data collection in order to give us a really full picture of what was going on, to make sure that we could triangulate across sources, to make sure that if we saw something over here, it wasn't just a one-off thing. We could actually kind of document that we were hearing this in multiple places. And so you reach what's kind of like known as saturation. You reach a level of saturation where you've heard enough of the same thing where you can have confidence that that's actually what's going on. And that was really important and powerful for feeling good about moving forward the way we did, right? And I think that that is the value of what we do at NORC and how I think we should be doing health communication research in general. We need to be looking at multiple data sources. And it's so important today because one, it's getting harder and harder to collect data from people, right? So the days of mailing out a survey or sending a web survey out or knocking on doors, it is so hard to get people to respond. So that becomes difficult. And then in addition, people are just being exposed to so many more messages through so many more micro channels, right? Whether that's a particular podcast that you listen to or a streaming content service that you watch, or you exposed to things in social media or through various platforms that you engage with online, or things through your mobile device, right? Like whether that you subscribe to certain types of text messages or you're part of different groups. People are exposed to a lot of information, and how they process that information and what that means in terms of their health behaviors. This is a messy environment. And so the more we can pull in data from these different modes and different sources, the better we can do in terms of trying to interpret and understand what people are going through and what they need, and how we can develop something that actually meets them where they're at and gives them something that's useful and effective. And so I just, we actually at NORC have a model of this. And we've published this model. And so this is now available to people and it's published in the literature. So it is, I think, a great way to think about how you can approach something. It's scalable for budget and time and whatnot. But again, using multiple data sources so that we can really feel we have confidence in what we're doing, I think is the best way that we can be doing this research right now.
Perfect. And about the messaging itself, how do you navigate this challenge between tailoring health messages for cultural specificity and maintaining this broader and universal accessibility?
Yeah, I think it's a really good question. And I think that we have to remember that, and this was probably always the case, but it is especially the case nowadays, that there's not one message to rule them all, right? We live in a time when people subscribe to information, they follow and like different channels of content, they buy things through online vendors that give them recommendations for other things that they might like based on past purchases. We are living in a time of tailored and personalized experiences. And there's an expectation that health and health messaging should also be very similar. And I think the expectation and the need for that, I think, has always been there. I think as health communicators, I think as health communication professionals, as public health professionals, we actually do need to do a better job of tailoring messages for people and not using always a generic message. There may be cases where a generic message is warranted. It's highly likely that there's going to be a need for accompanying messages that are micro tailored to certain communities and groups of people. But that's where the data comes in. I think we have to let the data tell us what is needed. And my suspicion, based on my experience, is that in almost all cases, one message is not going to work. But it doesn't mean that a generic universal message and several tailored messages are working against each other, right? I think that there isn't necessarily a tension between those two things. I think they just have different purposes. And so figuring out what is needed, what kinds of messaging can work at a global level versus at a micro level, is just really key. And that's part of what you discover through your formative research.
And still following up on this health messaging, I would love to speak a bit more about NORC's Health Communication AI initiative. For our listeners, would you be able to briefly explain what this is?
Yeah, sure. So I'm really excited to talk to you about this because this is sort of a really important initiative, I think, for the organization and for myself personally. It's something that we've actually been undertaking now for more than a year. And it really emerged out of this recognition that while AI has been with us for quite a while, the advances in AI technology are drastically changing our communications environment, but also opening up opportunities, I think, for better health communication practices. So, health communication AI, at its core, is an AI agent that is based in health communication best practices and founded on long-standing health promotion programming theories. In particular, it builds off of a work done around opinion leaders and opinion leadership. And just very quickly on that, opinion leaders first show up in Everett Rogers' diffusion of innovations theory. And they are powerful people within a social network that have the ability to disseminate a new idea of any kind. It's not specific to health, throughout a social network, and they have the ability to sort of leapfrog the spread of those kinds of innovations because they have credibility and are trustworthy with their communities. This is a theory and a framework that has been used in health promotion programming for a very long time, with lots of success shown around how they could be powerful messengers. And my own work extended this into the digital space, looking at social media influencers as opinion leaders for health. And we've shown similar positive results where exposure to influencer messaging can have positive, statistically significant positive effects on people's knowledge, attitudes, beliefs, and behaviors relative to different types of health issues. As we stand now at this precipice of AI and Gen AI in particular, changing drastically the way that we work, thinking about how AI and Gen AI technologies become the next form of opinion leader is what we're doing at NORC. And so it Health Communication AI, the agent that we are working on, it merges this sort of theoretical and evidence-based approach to health communication with the abilities of Gen AI technologies to enable the communication of evidence-based, tailored information to anyone, anywhere, at any time that is scalable and can be done in empathetic ways. So this isn't a chatbot that provides you with basic Q&A sounds very robotic. Um, the sort of very important piece here is that we can actually have empathetic conversations with people via this agent and these technologies in ways that we as humans we can't accomplish, right? We cannot scale to meet the need of people's health queries right now. We can't always tailor enough to people's individual contexts and situations. And we certainly can't always be empathetic with people, right? It's just impossible. And then we're not always accurate as much as we want to be accurate as humans. There's error. And so while we're still sorting some of this out, there is this, I think, very incredible opportunity that is lying before us to reimagine how we do health communication with people and to engage with people in a completely new way that we have not been able to do before. At a meta level, though, health communication AI is also a brand new scientific agenda, right? So we have this sort of new approach to communication, but we also know that AI is just affecting people's health and well-being overall, right? Through engaging with these tools, through the different types of messaging that they're being exposed to. And so we are building the early evidence base, and we're calling for others to join us in building this early evidence base around what is happening out there? What are people being exposed to? And what are the resources and supports needed for parents, for caregivers, for teachers, for policymakers, for healthcare providers, for youth, in order that they can navigate these spaces safely and effectively. And so this is a broad agenda that I think will take us into the next, decade of work for the field. But we are looking to do things in the short term because it is so critical and things are moving so fast, both at this level of human communication as well as what are the broad research priorities for this space.
That's amazing. And I think it's so important, that balance between the science rigor and the empathy to build trust with those that are receiving the messages. Are you putting any processes in place to ensuring that this is effectively being done? The balance between the scientific rigor and the empathy.
Yeah. I mean, this is the work that needs to be done right now, right? Is like, what are the benchmarks? What does it mean to not have 100% accuracy, right? How do we first do no harm, right? This is health information, and people are potentially going to engage with these kinds of agents and bots for information that they will then make health decisions on. So to be clear, we're not releasing this to the wild right out of the gate, right? We are conducting a series of research studies to both refine what we're doing as sort of the actual technical agent, but also to look at how does messaging from an agent compare to messaging through other channels that people might already trust. And so we're doing that research, and we'll be able to provide that information to inform the field.
From your point of view, do you see any sort of misconceptions around how people see AI's role in health communication?
I don't know that there's specifically misconceptions. I think people are very worried. I think we've been worried, right? We've been feeling the effects of AI-driven information, inaccurate information in many cases, in terms of health topics and health decision-making for a while now. Like, this is not anything brand new. And so I think that it's not a misconception to be worried. I think there are big questions we still have to answer. Things are moving so much faster than like policy or regulation is moving. So we do have a lot of big questions to answer as we move forward around ethics, around regulation, around copyright, around benchmarking, which we just talked about. Where I think that there might be a disconnect is that as much as AI is a challenge for us as health communicators, it is also a solution. It is a tool in our toolbox that we can use to advance the work we do in a meaningful and productive way. And so public health is not always the first penguin, right? We are not necessarily the people who are out of the gate doing the most innovative things first. And that partially comes because we look for the evidence, we want to build the evidence, we want to make sound decisions. I think the challenge and the tension right now is this is happening and it's happening quickly. And we need to engage in this space now so that we can have a voice and a say in how these tools are developed. And they're, they're not being developed for health context for the most part. They are being developed for commercial context. And that's fine. I mean, that's where a lot of the money is. But I think as health communicators, as public health practitioners, we have the ability now to engage and have a say and make a case for why and how these should be developed for our purposes so that we can do our jobs better, so that we can help people, so we can build trust, not erode trust further. One example, right, is that many of these tools are not necessarily being built with inclusivity in mind, right? So you're seeing several of the early tools, they have white people, white women avatars. We should be working and starting from a place of where we need to be building this for both cultural and linguistic competency, and so that they can work for all people. And yes, that is complicated. I'm not trying to gloss over that from a technical perspective, but we do need to be thinking about that up front. And we in public health, I think, have the ability to raise those important issues early so that we can be building for that as the end goal. And so I think that it's maybe not a misconception, but there's a disconnect. And I hope that people can start to see this as an opportunity as much as it is a challenge.
So a follow-up to that as what kind of skills, what kind of frameworks do you think are important for health communicators to learn to overcome these challenges and future challenges around this?
Well, first and foremost, I would encourage health communicators and public health professionals to engage with the tools that are out there, right? So engaging with the ChatGPTs of the world, embrace working with some of there are AI video platforms and AI image creator platforms, and some are better than others. And we do have to, consideration is making sure that they are, safe in terms of copyright and whatnot. But do some research or read some of the trades or talk to some trusted colleagues. Start experimenting, start working in these tools so that you understand how they work and what can be done and what are the limitations and where are the challenges, and have those conversations. Have the conversations around disclosure. Like if you're going to use an AI generated image in a particular piece of collateral, how do you disclose that? Do you disclose that? Does that make a difference on how somebody perceives your message, right? Some of that has to be done in terms of by researchers, and I would encourage people to do that research. But still, I think the questions and the engagement and the thinking is really what matters right now. So learn the tools, read the research, fund the research, right? Fund the research that you want to have answers for, and then share and like watch webinars or go to conferences or read the trades, listen to the podcasts. I think not everyone has to be a data scientist. Not everyone has to know how to build the agents. Partnering with those folks is a really good idea, because oftentimes those are the folks who are making some of the decisions around what data and what content is being used to model on, right? And they're not always going to be the expert in the particular topic at hand. So the health professionals partnering up with the data scientists, I think, is really important in order to ensure that it's, that there's good data in order to have good outputs out. And so I think it's a little bit of, you don't have to learn how to code, but you do have to understand how these things work, and you do have to understand how people are using them. And if you don't know and no one knows yet, do the work, do the research, talk to researchers, fund their research, because we need to figure some of this out still, and then partner up and then reach out across the table, across industry, and work collaboratively to answer some of these big questions so that we can develop tools that work for us.
That was already a great piece of advice. One final question would be, do you have any resource that you would like to share? A book, a podcast, an article, a framework, anything at all?
Sure. And you can tell me if these things can be put in the show notes or whatnot. But I would encourage people. There are lots of AI podcasts out there. You could probably just do a search and find one that you like. I particularly like the AI Marketing Institute podcast. That's a really great one. I would also encourage folks relative to this conversation. We have a paper out on health communication AI, and that's I'm the primary author on that, and it's published in the Journal of Health Communication. That would be another paper you could read about sort of the thinking around this idea. And the third thing I would say is we do have our model for, how to do campaign evaluation in today's media environment. And so, again, that paper, I'm the primary author on it. That's published in the American Journal of Orthopsychiatry. And so people can go and find that paper there. And I can also provide you the citations to put in the show notes later if you're open to that.
Perfect. Thank you. Yeah, we will add those to our notes. Thank you so much, Amelia. It was a pleasure having you here. Thank you so much for your amazing insights.
Yeah. No, thank you, Marta. This has been so wonderful to chat with you this morning. And thanks just for having me on your podcast. And this has been awesome. Thank you.
Thank you.
Survey and Beyond, the data collection podcast, is brought to you by Survey CTO. To find out more about Survey CTO and how it ensures reliable, secure, and scalable data collection, visit www.surveycto.com. And make sure to search for Survey and Beyond, the Data Collection Podcast in Apple Podcasts, Spotify, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Survey CTO, thanks for listening.